First of all, child and adolescent mental health is among the most neglected healthcare needs in the nation. And this is especially true for youth with, quote, internalizing issues, youth presenting with depression, anxiety, trauma-related problems, social withdrawal. These youth are very unlikely to receive mental health services. Evidence indicates they're also very unlikely to be identified for and receive special education services. And there's a big gap between when these youth begin to have problems and when they receive services. Often it takes years, and the longer the delay, the more the problems accumulate and become more serious for the young person. So PBIS represents the ideal platform to implement programs, to promote student mental health, to intervene early, and to provide intervention. There's a parallel movement for the mental health system to work in schools. But if the mental health system just comes into a school without PBIS, it tends to be ad hoc. For example, co-located, the clinician's off in a corner, no one knows what they're doing or who they're working with. As compared to when clinicians join with PBIS, they become a part of the team. We use data for decision making. There's a tremendous benefit, for example, within PBIS to implement universal screening for emotional behavioral issues in youth. And we know that when we implement a screener like that, we're 2 to 3 times more likely to identify youth in need, especially youth presenting internalizing issues. And again, when we can identify those problems, we can intervene early. PBIS also provides a great platform for implementing evidence-based practices and assuring that they're implemented correctly, refined using data, et cetera. So this marriage between school mental health and PBIS is really, in many ways, the most important platform that we could develop to improve the mental health status of children and adolescents in our nation.